Being supportive of elderly patients. 5 ways children can look after their aging parents. First, they could provide home care for their aging parents. This can involve shopping and transporting for them, paying health aides to bathe and feed them, or working on their physical therapy with them. They can also send them to an adult daycare, which is kind of like a camp. They get meals and spend the day there. They can move them into a continuing care retirement community. This allows them to still be independent but a part of a community with help if they need it. The children can also spend quality time with them at least once a month or more. This helps them feel loved, heard, and respected. Make sure that your aging parent is happy and not experiencing abuse or neglect. So, elderly abuse is when an older person has acts of aggressions towards them. This can involve physical assault, financial assault, or abuse, verbal abuse, and emotional humiliation. And then neglect involves failure to give adequate care. This can involve improper hygiene care, improper shelter, rooming, clothing, improper meals, and more. And a lot of the elder neglect and abuse goes unreported, which makes the prevalence almost non existent, which is very sad and scary to think about. The paid caregivers are responsible for more than half of all elder abuse neglect. There are 2 models that kind of describe what an elder abuse or neglect can look like. There's a caregiver model of elder abuse and neglect. This is when caregivers who neglect abuse elders because they are overwhelmed and stressed with their responsibilities and burdens. And then there's also the domestic violence model of elder abuse and neglect, which is when elder abuse occurs due to illegal family violence and due to the negative personal characteristics of the abuser, which allows for a better outcome of arrest and prosecution. So, elder abuse and neglect prevention. Some ways you can prevent it is by making sure that the elder person is engaged with their community. You can allow the elder people to have somebody to talk to 24/7, like a therapist or HR. You can make sure that the caregivers and providers are properly trained in prevention tactics and signs of abuse or neglect. You can monitor and inform elder people of financial scams from solicitors on the phone or people that come to where they live. You should have friends or loved ones visit often. And you should also install security checks and second checks from more than one caregiver. You have to make sure that an elder person doesn't only have one caregiver assigned to them. Some red flags of elder abuse. Elder people give large sums of money away in a short period. That is a sign or red flag of abuse or neglect. Injuries such as bruising, poor hygiene, weight loss, anxiety, depression, withdrawal from society. Signs of self-injury, major personality changes, unreported falls, injuries or visits to the hospital, and refusing visits from family members or friends.